Could your low iron be contributing to your hair loss? Oftentimes, women will get their labs drawn, including an iron panel, which demonstrates a low ferritin level. Ferritin is the storage form of iron, but it's also an acute phase reactant, so what I'm saying does have some caveats. We know that low nutritional status can contribute to hair loss, but sometimes what's not as obvious is low ferritin levels can also contribute to hair loss. The problem is often what is seen as normal is still way too low, and it's really not normal at all. See, there are stages of iron deficiency, and in the first stage, iron stores can be totally depleted without causing any anemia because there's enough iron in the body from the daily turnover of red blood cells for normal hemoglobin synthesis to continue. But studies show that once your ferritin drops below 50 nanograms per milliliter, many people actually start to experience signs and symptoms that are similar to anemia. And below 30 nanograms per milliliter is strongly associated with telogen hair loss. But you can see many labs have a reference range, which includes numbers that tell the provider what is normal for that lab. And you can see that the lower end of normal of many labs is still way too low. So if your doctor is relying on this information to make a decision about what is normal regarding ferritin, they may miss the mark. Most physicians who are aware of this phenomenon actually like to see the ferritin levels over 70. Personally, I like to see ferritin levels over 100. Now, a huge caveat here. The lower your ferritin, the more likely it is a contributing factor in your hair loss. However, there are many reasons for hair loss that range from stress to febrile illness, hormonal changes such as pregnancy or postpartum, aging, you name it. But one reason that is often not even considered is low iron stores, which is actually a very common problem, particularly in women. So I think it's a worthwhile investigation to explore with your physician if you are experiencing hair thinning or you have other signs and symptoms of anemia to go ahead and check those ferritin levels. And if they are below 50 to 70, advocate for repleting those iron stores.